If you have bipolar disorder, BD, there's a chance you may also have another coexisting condition, known as a comorbid condition, or a comorbidity. In fact, you'd have a 6 times greater chance of having an anxiety disorder in your lifetime. 42% of people who have bipolar disorder also experience some kind of anxiety disorder, according to a recent meta-analysis of research. That's why doctors will often screen for an anxiety disorder and bipolar disorder at the same time. The tricky thing: certain symptoms of anxiety disorders and bipolar can look the same, complicating a person's presentation, treatment, and prognosis of both conditions. Having a comorbid anxiety disorder can also increase the likelihood of substance abuse and suicidal thoughts and behaviors, so watching out for the signs and symptoms is critical. Read on for the 6 anxiety disorders that tend to show up alongside bipolar. 1. Panic disorder. Panic disorder is characterized by unexpected and repeated episodes of intense fear and occurs in about 1 in 5 individuals who have BD, more commonly in those with depressed and mixed states of bipolar. Physical symptoms include chest pain, heart palpitations, shortness of breath, dizziness, and stomach aches, and bipolar disorder can increase the likelihood of panic attacks. 2. Generalized anxiety disorder, GAD. After panic disorder, GAD is the most common comorbid anxiety disorder in BD. People with GAD experience a constant state of excessive worry over everyday things, personal health, work, social interactions, most days for at least 6 months. The main symptoms include irritability, muscle tension, difficulty concentrating, sleep disturbances, being easily fatigued, and feeling restless or on edge. 3. Social anxiety disorder, SAD. People with SAD, also referred to as social phobia, experience overwhelming and extreme self-consciousness in social situations. When in front of others, symptoms of SAD include rapid heart rate, nausea, panic or feeling their mind is going blank, and fear of judgment. Some research has shown that people with comorbid SAD and BD have higher rates of atypical depression. Their mood improves when something positive happens, as well as traits of other anxiety disorder comorbidities, PTSD and OCD in particular. 4. Post-traumatic stress disorder, PTSD. PTSD can develop after experiencing a terrifying event, usually involving the occurrence or threat of serious physical harm. Symptoms include hypervigilance, hostility, mistrust in others, social isolation, flashbacks, insomnia, and nightmares. The link between PTSD and BD is unique because both manic and depressive episodes can sometimes be perceived as traumatic events, not to mention, having such episodes may even increase the risk of traumatic events, triggering more anxiety.
5. Specific phobia. More than 1 in 10 people who have BD also have a specific phobia, and it's more common in women than in men. Phobias are a type of anxiety disorder, defined by having such an extreme fear or an aversion to something that it's physically or psychologically disabling. In many cases, phobias start in childhood, and some research suggests that familial factors play a role in instances of comorbidity with BD.
6. Obsessive-Compulsive Disorder, OCD. There's a big debate over whether OCD is a true comorbidity of BD, or if it's secondary to it. Either way, the linked conditions frequently begin in childhood or adolescence. OCD is characterized by repetitive, unwanted thoughts and performing behaviors like hand-washing, counting, or cleaning in hopes of making the thoughts go away. When OCD and BD coexist, these symptoms usually show up during depressive episodes and stop during manic, hypomanic episodes.